Okay. My second question is asking me if I felt depressed over the year or felt anxious. I think the most depressing time that I've had is when we had the first announcement of lockdown due to COVID. I was working in the Eastern Cape and I had to drive back to Durban for the lockdown. And my kids were going to visit my mother and spend their lockdown time with my mother. For some reason, because of the unknown, I found myself very, very depressed. I even cried in the car, and I just imagined the worst, because there was so many things that we didn't understand about COVID, how it will affect us, what will be the outcome, and how long the lockdown would be. And I knew that at work, since I'm working on the health-related field, we were cautioned that we must come back, but we'll be assigned task to work on COVID matters in the community. So I was very depressed, anxious, confused, and knowing that I didn't have my kids around, I think that made it worse as well. So there is the time that I can recall is the time when I felt very depressed, and then obviously also looking at the different chronic illnesses that I live with and some of my family members live with. My mother, to speak, also with her age and other chronic illnesses that she was with. It was depressing because I would think and imagine the worst of maybe having my family members pass through COVID, or if I could be infected and pass, and how will my kids survive if I'm not there to provide for them. So there were concerns about health conditions, and even right now with the new strains of COVID that is coming up and the announcement of a possible third wave of COVID, it's still scary because we know of people that have died through COVID, and if they could die, you think to yourself, it could be me next, and how that will impact your family. So it's some subjects that is quite stressful, but I think we try and sort of ignore it and not deal with it, just so that you can go through day-to-day activities the best way that you can, or the normal way that you can. But generally it's quite stressful and hard. Yeah. And then my third question is asking if I find socializing causing anxiety after lockdown and isolation, or because of health concerns. Generally, yes, I do find socializing and being with people stressful, and I go out much lesser than I would because I try to avoid exposure to COVID from being in crowded places. Maybe this year I've been to, if I exclude the work-related activities that I've done, I've been out at least twice on a social gathering, and it was close friends, and but still, because we were on a public space, it's still scary because you don't know what to expect and what could happen. Yeah. And then my fourth question is asking me if I have increased aggression from others, or for you related to such situation caused by COVID, lockdown restrictions, work changes, relationship issues? Well, with experiencing an increased aggression due to COVID-related matters, I doubt that I have, or I can't recall any of the aggression at the moment, besides knowing that personally I'm quite sensitive to the issue, and it's something that I sort of feel that it's serious and people are not taking it seriously. But as much as it's serious, also I try very hard not to think about it a lot, because it brings not so good feelings and imaginations that I would like to avoid most of the time, because I don't like ending up imagining the worst that could result due to COVID. Okay, my other next question, number 5, is asking what access is there for mental health access services like social workers or psychologists. On this note, I think in my workplace they had a program available where you can talk to a social worker or to a psychologist or a counselor of some sort, because I remember in December we had an outbreak in one of our offices that I supervise, and I had to go there and close the office, put people off, accompany people for testing. And actually there was another very depressing moment with me, because if I remember well, I even cried on the phone when one of the ladies called me from the funder checking on the situation, when she heard that we had COVID cases in the office, and she found me when I was still struggling with dealing with it in the office, and I was trying to be strong for the team, and I just cried on the phone. And I had to go and ensure that staff are tested. And because I had the money from my work, so I had to be there physically with them to pay, and also to try and assist with some level of transport. So it was quite stressful, because in the afternoons I would go home and think, what if I'm infected, and now coming back and infecting my family. Yeah, so there was a very stressful moment for me. And then I did get access to a mental health or a counselor telephonically, and counseling was done. At that time it didn't feel like she was making any sense with whatever that she was saying, because, you know, I was like, she doesn't understand what I'm feeling at that time. And worse, being on the phone, I cried several minutes on the phone talking to her. And there was even a general pressure of our work and targets, so I was just not coping at that moment, having to deal with people that are tested positive, that we have to close the office, and we are losing on days where we could be doing some work that is contributing towards meeting our target. Yeah. But since this year, around March, I think, beginning March, we were told that the services are terminated and the company is still looking for another service provider. And that means that at this moment, there is no support of any kind that is available, because even when you go to government institutions, it's a process. It takes time to access such services, and with the queues and the time, basically I wouldn't go to the government institutions either for access of such services. I would have to find my way of dealing with it, because if I had medical aid, I would have gone privately to a psychologist or a social worker or whatever, a counselor that is available to us to assist and support with mental health issues. Yeah. And these services are basically more for us that are working, and at times I feel that even my kids at times might need some support, and I'm not able to provide them because they are not in any medical aid where they could go to a private doctor, psychologist, social worker for any help. So that is how life is. And then my last question is asking, what have you done to take care of your mental health? Share examples and photos if you started a new hobby. I don't think I have done much to take care of my mental health. Not much at all, because I don't have any new activities that I'm doing. At some point, I think I bought some games that we played at home with the kids, my sisters, and maybe it is some sort of a one thing that I can sort of relate in terms of being close towards doing something that makes you relax and not think about other things, or try to lower your stress levels. But besides that, there's nothing really that I've done to sort of take care of my mental health. Yeah. Thank you so much. But COVID is scary.